Hello, this is Jantia Dusenge, a student at Southern New Hampshire University through Kepler program. I am recording myself in order to talk about a project called Employee Healthcare Human Resources. Let me start by uh, talking about the paths, the career paths available in healthcare industry. And the first one is therapeutic services pathway, which is all about changing the health status of patients over time through direct care, treatment, counseling, or health education information. A second one is called the diagnostic services pathway. The diagnostic service pathway includes all tasks related to test and evaluation that help in detection, diagnosis, and treatment of the disease, injuries, or other physical conditions. Support services pathway. It's all about interacting with the patients or the public to provide the therapeutic environment for the delivery of the health care. Also, the fourth one is health informatics pathway, which includes workers involved in all aspects of managing healthcare agencies, patient data and information, financial information, and computer applications related to healthcare processes and procedures. Medical informatics is an intersection of information science, computer science, and healthcare. The last healthcare pathway is called biotechnology research and development pathway. The biotechnology research and development pathway consists of tasks involved in bioscience research and development as it applies to human health. Yes, so let me talk about three different examples of non-clinical healthcare jobs and the education and skills that are needed. Non-clinical roles include medical billers, coders, transcriptionists, hospital executives, receptionists, and anyone who works behind the scenes at the hospital, such as human resources, IT, biomedical technicians, administrative assistants, and other many. Yes, to be able to work at the hospital as a non-clinical staff, you need to have communication skills, because communication skills are very important because they help people to get to one another. As someone who works for others, it is very important to know how to communicate with them in a way that is not offensive and which is productive. Uh, this will result in satisfaction of patients and their families, which is a part of healing. Also, being able to communicate effectively will reduce errors that may affect negatively the health of the patients. It will save time and effort. Quality improvement skills. Non-clinical healthcare care workers should be very creative and innovative in perceptive of ameliorating the quality of the service that they provide to the patients and their families. Leadership skills. Having leadership skills is very important for workers who work at the hospital. They need to know how to lead people in an effective way so that they will be able to reach the hospital's goals. Let me explain the allied health professionals and some examples. Allied health professionals are people who work in the segment of healthcare field that delivers services involving the identification, evaluation, and prevention of diseases and disorders, dietary and nutrition services, rehabilitation, and health system management. I may mention dietetics, which are people who know about the diet and its effect on health, especially with the practical application of scientific understanding of nutrition. Radiography is an imaging technique using X-ray, gamma rays, or similar radiation to view the internal form of an object. Rehabilitation counseling Rehabilitation counseling is focused on helping people who have disabilities achieve their personal, career, and independent living goals through a counseling process. Respiratory therapy. A respiratory therapist is a specialized healthcare practitioner trained in pulmonary medicine in order to work therapeutically with people suffering from pulmonary diseases. Speech language pathology. Speech language pathology. Pathologists must be able to listen and communicate with their patient in order to determine the right course of treatment. Audiology is a branch of science that studies hearing, balance, and related disorders. Audiologists treat those with hearing loss and proactively prevent related damage. Let me talk about LPN, RN, and yes. The difference and similarity between LPN and RN is, first of all, we need to know the meaning of RN. RN means fully trained nurse with an official state certificate or competency, while LPN is a licensed practical nurse. RPN, known as registered nurse, also need to have a Bachelor of Science degree and is a graduate of 4-year nursing program. RN learn about pharmacology, physiology, the liver system, and they need to pass a National Council licensure examination for registered nurse in order to practice their profession. The length of study to become a licensed practical nurse is much shorter than the length for registered nurse. LPNs need only to complete a 1-year practical nurse program and pass the National Council licensure examination. Also, when you talk about range of duties and responsibilities, LPNs are always supervised by either a registered nurse or a doctor. They cannot make independent medical decisions regarding the care of a patient. They typically prepare and assist patients with the feeding, dressing, and bathing, insert catheters, collect samples, prepare and give injections, and dispense certain drugs or medications. However, they cannot administer restricted medicine or intravenous narcotics. Yes, this is all I can talk about RN and LPN, but I need to talk about some similarities. Both RNs and LPNs work directly with patients in varying degrees. They are responsible for the care and well-being of their patients. Both are highly employable in different work settings because their work brings them in constant and direct contact with people. RNs and LPNs have to be sociable, approachable, and exhibit a genuine desire to help these people. Thank you very much for your attention. I hope this content were very helpful and